I can see your sexual health affecting your money as well as your
Big
mental
time.
health affecting
Yes.
your money. Yeah, big time. So
Big
talk
time.
about
Big
that
time.
a little bit as well.
Yeah.
Yeah.
So when you're not happy in relationship, when you have issues with your sexual health, it definitely causes more stress and definitely affect life as well. And at the same time, when you are overly stressed, when you're not feeling well, that will affect your sexual wellness as well. And I've seen it a lot in the practice. My past experience, I used to work in gynecology settings, so I will deal with a lot of patients coming in. Either younger generation coming in and having polycystic ovary syndrome, a lot of hormonal discomfort, acne, hair loss, a lot of issues at the younger age, or when we get into perimenopausal years, we're talking about 30s, 40s, and we get into menopause, shift in hormones, stress affect shift in those hormones, decreased libido, no desire in sexual activity. We're talking about decreased sensation in the genital area. So there's a lot of other things that get affected, unfortunately, with stress as well. And we launched our sexual wellness program last year, very successful. We're treating men with erectile dysfunction or just even improving. You don't have to have a problem. There's always a way to improve it. I see a lot of females that have decreased libido, decreased sensation, and other issues that they develop. So there's certain treatments for that too. So we eventually, our book is coming out next month. So we wrote a book called Sex in the City. It's a great book. We wrote it more. We have fictional characters there. It's not a medical textbook anymore. It's more kind of giving people a way to realize that they don't have to live and suffer in silence. Sexual wellness, it's still the topic, or sexual health is a big taboo, or people feel ashamed to talk about it, or they might consider, oh, I don't want to have sex anymore. I have decreased sensation. It's part of aging. I'm getting old. That's why I have an issue. No, it doesn't have to be. There is no limit of when you should stop having sexual activity or enjoy your sex life. There is no limitation. I have patients that coming in the 80s and 90s and still having partnership and kind of looking and, experimenting. And it's great. Why not? Actually,
Why not?
Statistically, the STDs, the transmitted disease, they go on the rise after menopause because you don't worry about getting pregnant anymore. You don't use protection. So it means that activity is there. So we would like people to enjoy getting in a relationship. You don't have kids anymore if you're in a family. You're done with your career. You don't have to worry about things. So you enjoy the relationship. And we want people to enjoy it. So in that book, the message that we're trying to send to people with the book that we wrote, that it's okay to talk about it. That's the biggest hurdle for patients to come in and acknowledge that they have a problem and trying to find solution. That's the first step. And that's the hardest step. People, when they come in, it's like, I need to talk to you about something. Okay. What you would like. And it takes them time to tell that I don't feel well, or I don't enjoy sex anymore. I don't have the sex drive. And it could be both. It could be man, woman, whatever. There's different issues that happen in our life. And part of it is hormonal. So we need to address the hormones. A lot of stress affect our hormones as well. So we might need to address stress first before we deal there with the hormones and sex life and everything else. And if you're not happy at home, if you're not happy in your relationship, what kind of energy do you think you're putting out? It will affect your money as well and your wealth, because energy, as you said, it's energy. It's not separate from one to another. Everything is connected. So, the book is coming out. We're very excited. We put a lot of thought and effort into it. And I hope it will help people to acknowledge that they need to get help if they need it.